I think that it's important for people to know that there are resources available out there and there are practitioners, healthcare providers who can really make a difference and know that there is help. I've seen so many patients who've really, when they get the information that they need, they've been able to make really big changes in their lives.
Alrighty, welcome. I am Charles Thorpe, and this is the Doctors Making Videos podcast, where we bring you real doctor-led conversations about medicine, online content, and impact. Today I'm joined by Dr. Clair Francomano. She is a professor of medical and molecular genetics at the Indiana University School of Medicine and is one of the world's leading experts on Ehlers-Danlos syndromes. She originally trained at Yale and Johns Hopkins, where she completed her residencies in internal medicine and medical genetics. She served as clinical director at the National Human Genome Research Institute at the NIH, where she led a 20-year natural history study of EDS that shaped much of what we know about these disorders today. Dr. Francomano has been widely published in over 160 scientific papers and received a Lifetime Achievement Award from the Ehlers-Danlos Society. She also happens to be my mom. So thanks so much for being on, Mom. Dr. Clair, it's great to have you.
Thanks. It's great to be here, Charles. Thanks for having me.
Absolutely. So today we're going to do our best to get a lot of great information for people with hypermobility and Ehlers-Danlos syndrome. We're going to go through your work with them and also some resources that they might be able to use in the future. And please make sure to subscribe so you don't miss future episodes with leading experts and creators in healthcare. All right, let's dive in. Could you tell us the story about how you started in medicine? What made you want to get started and why?
Well, my dad was a physician. He was a general practitioner, and later he was kind of grandfathered into family practice. And so I saw him firsthand practicing medicine. He had an office that was in the basement of our home in Yonkers, New York. And I was always I guess I decided around junior high school sometime that I was going to be a doctor, but I didn't know what kind of doctor at that point. And when I was in high school, my junior year, I had a cousin who was in education, and she told my mother about a program at the Jackson Laboratory, which is a mouse genetics lab. And they have a summer program that's sponsored by the National Science Foundation for summer students to learn about genetics. And my mother thought this would be a great idea for me to go to this summer program, and she encouraged me to apply. I was pretty sure I wanted to go to music camp, but I applied kind of to humor her. She told me, just apply. You probably won't even get in. It's very competitive, So I applied, and then I was accepted, and it looked pretty cool. So I decided to go, and I had a fabulous summer. I learned about mouse genetics, and I never looked back. I mean, it was just, it set me on this path of genetics, and it was really a life-changing experience.
Yeah, that's amazing. Great to hear Grandma bought you the ticket, set that life path. That's so cool. Okay. So can we talk a little bit about the outcomes you help your patients with? What do they generally want your help with? What do they want to see happen with care?
So typically, patients come to see me for two different things. One is to establish a diagnosis, to figure out why are all these things happening to me. And then they have specific medical concerns that they'd like guidance in trying to navigate. So often people have been on a very long diagnostic journey. They've been looking for answers for many, many years before they come to see me. So that's one of the things we do, is go through the diagnostic checklist and figure out if there's a reason that they might need genetic testing, if there's any suspicion that they have one of the genetically defined types of Ehlers-Danlos syndrome, or perhaps even one of the other hereditary disorders of connective tissue other than Ehlers-Danlos syndrome. So that's a main focus of my visit often, is just to establish the diagnosis. And then I have people fill out a pre-visit questionnaire and to give me the top 3 things that they want to discuss during their visit. So I'm absolutely certain that during the time together, we'll be able to cover those, at least those 3 things. And, I go through the history of what those 3 things are, whether it's their chronic pain or chronic fatigue or gastrointestinal issues or mast cell issues, and try to give them a few guidelines about how to start approaching these various issues to help improve their quality of life.
Gotcha. Okay, so diagnosis is a big thing people want help with, and then you focus on those top 3 things. Perfect. Okay. Why do you think getting a diagnosis is so difficult?
Well, a lot of the symptoms that people present with Ehlers-Danlos syndromes and hypermobility spectrum disorders they're common symptoms. They're symptoms that people present with a lot of different things. So chronic pain and chronic fatigue they're manifest in lots of different diagnoses. And also, I think there's not as much awareness in the medical profession in general about the Ehlers-Danlos syndromes and hypermobility spectrum disorders and the really complex multi-system presentation that people can have with EDS and HSD. So, when I was in medical school, and when I was doing my training, I was taught that, and this is a quote from one of my professors, if everything is wrong, usually nothing is wrong. So if people come in with a very, very, very long list of multi-organ system complaints, unfortunately, physicians tend to just turn off. I mean, it happens a lot. So they think the person has some kind of, it's psychosomatic, it's all in their head. There's an immediate tendency to disregard the story that the person is bringing to the doctor. And I think that the Ehlers-Danlos Society and the work that they've been doing over the last 10 years has really helped with this. There's much more awareness now about EDS and HSD out there. There have been many more articles published. We've got the core network and a large list of professionals who are very, very aware of EDS and HSD. So I think we're making progress, but it has been a very long slog for many, many people before they get to me.
Yeah, it's such a shame that people get written off so often, even now. Let's dive into the problems. Can you give us an overview of the main systems that people usually come in with symptoms?
It's literally head to toe, but I would say that maybe the 2 most common ones that I see are issues related to the autonomic nervous system and chronic pain. Those probably are on 90% of the people I see have issues related to what is called POTS, or postural orthostatic tachycardia syndrome, and chronic pain. And the autonomic nervous system issues go way beyond the POTS also. There are issues related to sleep because the autonomic nervous system plays a large role in sleep. And so people have chronic fatigue because they're not sleeping well. And also the gastrointestinal system, the motility of the GI system is controlled by the autonomic nervous system. So problems with the autonomic nervous system really can impact many, many different systems in the body. And then the chronic pain is also, can be life-changing to people. People who have joint hypermobility have musculoskeletal pain because the muscles are working overtime to try to hold those lax joints together. And so they experience muscle spasms and aches and pains. There's something called myofascial trigger points that happen as a result of that same effort to hold the body together. So treatment of the musculoskeletal pain is really a very important part of what we have to do to help improve people's quality of life.
So you've got the head to toe pictures, it changes for everybody, but the main ones you see for almost everybody are autonomic nervous system dysregulation and the chronic pain. POTS, sleep issues, GI.
Right. Yeah. I would add the mast cell issues because that's another one that's really very often on the top 3 that people come in asking about. And the mast cells can impact the pain and they can impact the autonomic nervous system. So there's an interplay between the mast cell activation, the autonomic nervous system dysregulation, and chronic pain that's really kind of diabolical. We need to tackle all 3 of those often to optimize people's well-being.
Right. So the mast cells, right? Let's dive into the inflammation. Isn't inflammation, it's almost behind a lot of these systemic issues? Could you talk about that for a bit?
So the mast cells are part of the immune system. And when you look at them under the microscope, they have hundreds of little granules inside them that contain inflammatory molecules. And those inflammatory molecules are released into the tissue when the mast cells degranulate. They kind of explode, and those inflammatory molecules get released. So in the skin, we see things like rashes, hives, itching, and that reaction is often related to the inflammatory molecule called histamine. So the antihistamine drugs can be very effective in helping with that. But there are many other inflammatory molecules in the mast cells. And so medication to try to stabilize the mast cells and prevent them from releasing these inflammatory molecules into the tissue is really helpful to minimize the effects of the mast cell activation. And then I think for many people also limiting the foods with high histamine potential. So trying to consume foods that have really minimal histamine or inflammatory potential can also be very, very helpful.
Gotcha. Do you have any stories, or can you give us some context of how someone might have been suffering from particular symptoms beforehand, and then you started work on the antihistamine inflammation approach and how that helped and resolved some of those symptoms?
Yeah, I saw one patient very recently who actually told me that the treating her mast cells had really turned her life around because the mast cells were causing really terrible gastrointestinal symptoms. She was having a lot of abdominal pain, gas, bloating. There were some foods that were just causing like explosive diarrhea, and it was impacting the autonomic nervous system as well. So when the whole GI thing started, she also started having really bad issues with worsening POTS and worsening sleep and worsening fatigue. And by managing the mast cells, it helped her GI system tremendously. But really, there's this medication called cromolyn sodium that we use. Gastrochrome is the brand name. And that just really stopped a lot of the abdominal pain, gas, bloating, diarrhea. And as the mast cells got calmed down, her autonomic dysfunction kind of wound down also. So she's somebody who really, that intervention for the mast cells made a huge difference in her quality of life.
That's great. Okay, thank you. I want to take a turn more towards what people can start doing. So why don't we get started with how people can start approaching management. And I want to jump into that conversation with diagnostics and specifically labs, imaging. I know we've talked before and you mentioned that imaging can be a very important part of the diagnostic process or assessment. We're going to talk about how people can get doctors on their care team. We can talk about some of the steps they can do to start treating their symptoms, but why don't we jump in with like labs or getting assessment, diagnostic imaging, stuff like that.
Okay. So we haven't really talked about some of the neurologic issues that a lot of people present with EDS. They're not as common as the dysautonomia and the chronic pain and the mast cell issues, but they are much more common among people with EDS and HSD than in the general population. And these include things like instability where the head joins up with the neck, and instability at C1-2, which are the top vertebrae in the cervical spine, and something called a Chiari malformation. And The imaging is really important if you have a suspicion about craniocervical instability or C1-2 instability or a Chiari malformation. The signs and symptoms that we expect with those are headaches, neck pain. People often say they feel that their head just feels too heavy for their neck, or they have a sensation of kind of a bobblehead sensation, that their head is moving around on the top of their neck too much. And often they'll have neurologic signs, like they'll have numbness and tingling in their arms and legs, or they may have frank weakness in their arms and legs. And when the doctor examines them, the reflexes may be exaggerated, so they have hyperreflexia. Often people will say they have ringing in their ears or difficulty swallowing or changes in their voice. All of these are consequences of the neurologic compression that results from craniocervical instability or upper cervical instability and Chiari. So the imaging for this, symptoms are usually worse in the upright position, and it helps to do the imaging in the upright position so you can actually see the instability and the Chiari malformation more easily when people are upright. And there's something called an upright MRI machine where you're actually seated in the MRI machine rather than lying down in it. And they do the imaging with your head in neutral, and then in flexion, looking all the way down and looking all the way up at the ceiling. And then we can see how much movement there is between the head and the neck on these images. It's called dynamic imaging, right, MRI. And that's a kind of a specialized type of imaging that can be really helpful for people who are having those neurologic symptoms. In terms of the labs, the diagnostic testing, there are 13 different types of Ehlers-Danlos syndrome. And for 12 of them, we know what the underlying genetics are. We know the genes that underlie them, can test for those genes. So there's molecular testing, genetic testing that can be done very easily. Doesn't require a blood test. We're using what we call buccal swabs these days, where it's just like a big Q-tip that we just swab the inside of the mouth and get the cells there and isolate DNA, and we can do the testing on that. The most common type of Ehlers-Danlos syndrome is the hypermobile type, and there are a large number of people with hypermobile EDS and the hypermobility spectrum disorders for which we do not have genetic testing. And there are no red flags that suggest one of the other types of Ehlers-Danlos syndrome or one of the other hereditary disorders of connective tissue or neuromuscular conditions that can result in joint laxity. I have not generally been doing genetic testing in the absence of those red flags. But if there's anything that suggests one of the rarer types of EDS or other hereditary disorders of connective tissue, then I do recommend genetic testing to exclude those other diagnoses.
Okay. So just to recap a bit, the imaging is more specific for neurological complications. And then the genetic labs, we don't have specific labs for all the types, including the most common. And you will actually not do labs unless there's a red flag for one of the more specific types.
Yes.
I think that's a really important distinction where there's the clinical diagnosis and a lab genetic diagnosis. I think this is kind of an important thing for people to understand, where clinical is more what the doctor sees and you can diagnose with like in person, and then a genetic lab diagnosis. Could you talk about that? And then we can get into like how someone would actually go about getting these diagnoses and who they have to see.
Okay. Yeah, so in 2017, there was a big publication in the American Journal of Medical Genetics that put forward the diagnostic criteria for all the different types of Ehlers-Danlos syndrome and for the hypermobility spectrum disorders. And that issue of the American Journal of Medical Genetics is available on the Ehlers-Danlos Society website. So all those papers that were published in 2017 are freely available for any doctor who's interested in making a diagnosis and for people who are trying to establish a diagnosis for themselves. So there are clinical criteria for all of the different types where, basically we say we look for certain things in order to establish the diagnosis. They may be things in the person's history. They may be something in their labs, maybe something that we actually see on the physical examination. For the hypermobile type of Ehlers-Danlos syndrome, there are 3 diagnostic criteria, and the first is the generalized joint hypermobility. The second criteria has 3 features, and you need 2 out of those 3 features. And then the third one says that we've looked for all those red flags and we've excluded all the other possible diagnoses, which I feel we can do by a careful exam and by a knowledge of their person's history and their family history. So for the hypermobile type of Ehlers-Danlos syndrome, if we feel like we've done our due diligence and there's no red flags and they meet the clinical criteria, we can make the diagnosis clinically. For all of the other types, we feel like that somebody likely has the classical type or likely has the vascular type based on what we see on the family history, their own personal history, and so on. We really should do the genetic testing to establish that diagnosis and to say we have it on paper from a lab that says this person has a particular variant in their DNA that explains their presentation. If there is a suspicion for one of the genetically defined types of EDS or one of the other hereditary disorders of connective tissue, I do recommend people go ahead and do the testing.
Gotcha. That's very clear. So how do people go about, how would you recommend they get a diagnosis? I know we talked about earlier, it can actually be very hard. If they can find a good family practitioner, their general practitioner, could they just bring them those documents from the Ehlers-Danlos website and can any doctor diagnose it?
Yeah, so absolutely, any doctor can make this diagnosis. And if there is a family practitioner or primary care physician who's willing to take the time to learn about it, definitely they can make the diagnosis. And if there is concern about another type other than the hypermobile type or the hypermobility spectrum disorders, the primary care can make a referral to a genetics center, a genetics department at an academic medical center close to home, and those people can arrange for the genetic testing.
Nice, that's great. So it actually seems if you can find a good GP that you trust or a good family care doctor and they're willing to learn a bit or work with you, so you can get a referral to the genetics center to get those labs. And I imagine that would also be kind of the door into other specialty clinics, like if you need a neurological eval or need some imaging, your GP would also be the one referring you
to the specialists. Absolutely.
To the specialist.
I'd also like to put in a plug for the EDS ECHO program, which is run by the Ehlers-Danlos Society. The ECHO programs are designed for physicians and other healthcare providers, actually any healthcare provider who's interested. There's one program for providers in North America and another one that's run by Dr. Alan Hakim in the UK for people in the UK and Europe. And if patients have a primary care doctor who's interested in learning more, they can sign up for the EDS ECHO program and learn about the Ehlers-Danlos syndromes and management of the common complications through that.
Perfect. Okay. And they can access, so that's on the Ehlers-Danlos Society website?
Yes. Information about the ECHO program is on the Ehlers-Danlos Society website.
Oh, so those are already practitioners who have gone through the EDS training and are specialized, trained in it.
Well, anybody who's interested in learning about it do these EDS ECHO programs. There's a program now for allied health professionals. So for people who are in the physical therapy and occupational therapy, there's a specialized one for pediatrics. And we're encouraging also trainees in medicine to join so that the medical students can learn more about EDS and HSD because they're going to be the future of medicine.
Okay, so maybe the first step would actually be to go onto the Ehlers-Danlos Society website, see if they can find a practitioner in their area, and then check the ECHO program. And then beyond that, if there's no one local, then maybe try and find a family practitioner who will work with them and they can bring them
Right.
resources. Okay.
So I wasn't explicit about this, Charles, but there is a list of providers who, with expertise in Ehlers-Danlos syndrome and hypermobility spectrum disorders at the Ehlers-Danlos Society website. So that list of providers is a good place for people to start to find a practitioner in their local area, if that exactly is as you said. And the other resource that's there on the Ehlers-Danlos Society webpage is a list of the practices. So there's the program that we call the Core Network, which are offices and practices and networks of physicians and other healthcare providers who have expertise in EDS and HSD. And those core network practices are another great place for people to seek care. And they're all listed on the EDS website also.
Got you. Okay, that's great. We can do kind of a quick round and see what you have to say for these questions we pulled from your audience on Instagram. Down for that?
Sure.
Starting with, so pelvic floor issues with HEDS, especially frequent urination. What might someone do?
So pelvic floor issues are very, very common among people with HEDS. There's a lot of connective tissue in the pelvis that holds those organs in the proper place. And if the connective tissue is lax, it can really impact the function and the comfort in the pelvic area. If somebody is having a prolapse, urinary bladder prolapse or prolapse of the uterus, there are things that pelvic floor physical therapists can do to help strengthen the muscles in the pelvic region. And that's usually the first strategy, is to try to seek help from a pelvic floor physical therapist. The differential diagnosis, though, is broad. So some people with urinary issues may have mast cell problems that are causing the urinary issues. So there's a diagnosis called interstitial cystitis that's related to mast cells, and that's something that should be considered if people are having a lot of symptoms that feel like they're urinary tract infections, burning on urination and frequent urination. Often what happens with the interstitial cystitis is that it seems like a urinary tract infection, but when they go to get the urine cultured, there's no bacteria in the urine. It's just that inflammation from the mast cells. So that's something to consider. Treatment for mast cells may really help if that's what the issue is. And the other thing that just to have in mind with frequent urination and urgency of urination, if it's seen in combination with low back pain and a sensation of heaviness in the legs, it can be related to a tethered cord. So that's something else to consider if the urinary frequency and urgency is combined with a bunch of other neurologic symptoms that suggest the nerves at the bottom of the spine are being compressed.
Got you. What about treatment options to calm the nervous system down when it is going haywire?
Well, the nervous system going haywire. So presumably this is the autonomic nervous system, and the sympathetic side of the nervous system, or the fight or flight part, really being overactive. Trying to find things that kind of balance out the nervous system is one of the first strategies that I'd recommend to people. This includes things like mindfulness practices, meditation, making sure that you're getting enough sleep and enough physical exercise. All of these things can kind of help bring the nervous system back into balance. And I recognize that this is often easier said than done. It can be very difficult, especially when people are struggling with chronic pain. But trying to find things that bring joy into their lives can really, really help. Sometimes medication is necessary if some people have really, really rapid heart rate. The beta blockers can be really helpful. And there's a wide range of different medications that can be used to kind of calm down the nervous system if that is necessary. I'd like to give a plug for a really excellent monograph written by my friend and colleague, Dr. Peter Rowe. He wrote a book called Living Well with Orthostatic Intolerance. And I think anybody who's struggling with an imbalance in the autonomic nervous system can benefit from reading this book.
There's a few questions we can close out with getting referrals, but the last one I want to hear is some go-to approaches, how people can start managing the pain, chronic pain management. I know on your YouTube, you have a full talk, so I do want to push people there. If they want more in-depth, there's YouTube videos on this on your channel, but why don't we dive into that here?
So people who live with the Ehlers-Danlos syndromes and hypermobility spectrum disorders experience pain for many different reasons. The most common form of pain is musculoskeletal pain related to the joint laxity and the fact that the muscles are working overtime to try to hold those lax joints together. And so we see a lot of muscle spasm and pain related to the muscle spasm. And trying to get those muscles to relax is their main strategy to try to deal with the pain. So things like physical therapy with manual therapy, including deep heat, ultrasound, massage, use of electrical stimulation, infrared light, all of these things can help to get the muscles to relax. Magnesium is really helpful for muscle relaxation, and Epsom salts or magnesium salts, so the use of Epsom salts baths or Epsom salts foot baths can be really helpful. The use of a home TENS machine, transcutaneous electrical nerve stimulation, can help with muscle relaxation. There are a lot of different strategies that can be used to enable people to kind of get the muscles to relax. And then the work to do the toning and strengthening so that the muscles are able to support the joints but without causing pain is a really important component of the therapeutic development. So it has to be, we get the muscles to relax and then we do the toning and strengthening. Because if we just do muscle relaxation, then the muscles just it's a vicious cycle. They go back to being overworked and painful again. So that's the basic strategy for the musculoskeletal side. People can have neuropathic pain also, which is the pain related to the nerves, because the nerves may be pinched because of the joints being unstable, and the nerves as they travel through those joints are being pinched. So getting the muscles more stable and, if necessary, medication to help with specifically nerve pain can be very helpful.
Yeah, and again, I want to encourage people to check out your YouTube channel. You've talked in depth there, so I feel like there's a lot of good resources there as well. Okay, last one, vascular compression. I know compression stockings are a big thing. Can you talk about that for a bit?
So one of the strategies for helping with postural orthostatic tachycardia syndrome or any form of orthostatic intolerance is to help improve the circulation for the blood that comes back up from the feet and the legs. We know that people with hereditary disorders of connective tissue can have dilation of the veins. The veins can really dilate out and blood can pool in the feet and the legs. And there have been studies published showing that people can put up to a third of their blood volume in their feet and their legs. And it's just kind of sitting there and it's not available to return the blood to the heart and the lungs and the head. So the compression garments, including compression socks, compression leggings, compression bike shorts, any of these things can help the veins return the blood to the core of the body and improve the symptoms of orthostatic intolerance by doing that.
Great. Okay, thank you. All right, so we had a few questions from your audience about PCPs, referrals, how to find a specialist. So can you recap that process you would recommend? Especially someone said, what if a PCP is reluctant to refer out? How do you find a neuro GI specialist? How can I find an EDS specialist near me?
So 3 different strategies for this. One is to look on the provider list at the Ehlers-Danlos Society website. That's the first thing. And also to look at the core network list of providers in the core network. These are practices that have kind of raised their hands and said they have the expertise and the willingness to treat people with EDS and HSD. You might also see if there's a local chapter of a patient support group in your area, because those people will know. They'll know the doctors that are familiar with EDS and HSD, and you can get referrals to both primary care and specialists from the local people who are living with the same problems that you're experiencing. So I think those 3 resources are your best bet for trying to find local resources, local providers. In terms of other resources, there are a couple of other websites that I think it's good for people to know about. Dysautonomia International does a really great job of presenting a lot of information about the autonomic nervous system and management of dysautonomia. The Mast Cell Society has a really good website with a lot of great information about mast cell and treatment of mast cells. Another organization that has done a huge amount of educational work is the Bobby Jones, Chiari, and Syringomyelia Foundation, bobbyjonescsf.org. There are literally hundreds of videos on there about the neurologic issues and many other issues related to EDS and HSD. Those websites I highly recommend, and there are a couple of books that are available out there. There's one that I was involved in editing called Symptomatic, and there's another one called Disjointed, and the book by Dr. Peter Rowe that I mentioned earlier, Living Well with Orthostatic Intolerance, I think is a really, really helpful volume.
Great. I think before we started the episode, you also mentioned the Marfan Foundation for Vascular EDS and the Bendy
Yes.
Body podcast.
Yes. For people living with the vascular type of Ehlers-Danlos syndrome, the National Marfan Foundation, it's now called the Marfan Foundation, has a lot of really great information about vascular EDS on their website. Bendy Body podcast, Dr. Linda Bluestein does a fabulous job. She's got some really great podcasts on there with wonderful information, talking with many, many different experts in all areas related to EDS and HSD.
Gotcha. And then I want to relist those. So the Ehlers-Danlos Society has a list of providers. There's the core network. The EDS ECHO is resources for practitioners who want some training in Ehlers-Danlos syndrome. And then Dr. Clair's YouTube has a lot of other information and resources. Anything else?
I think that's a good start.
That's a good start. So how about maybe some words of encouragement too? And I feel like people might be really overwhelmed. They might be in pain. Do you have words of encouragement for them as they're working through their journey?
I think that it's important for people to know that there are resources available out there, and there are practitioners, healthcare providers who can really make a difference. And I encourage people to reach out to the support groups, to get their local support groups, to try to find local practitioners who can be helpful, and to use the resources available at the Ehlers-Danlos Society. There's a helpline there that you can call or send an email into. So please use the resources that are available to you and know that there is help. I've seen so many patients who've really, when they get the information that they need, they've been able to make really big changes in their lives. It's important to recognize that there is help out there, and there are things that you can do to improve the quality of life.
Okay, Dr. Clair, thank you so much. Great episode.
Great to be here with you.
Yeah, it's great to be here with you too. Alrighty. So yeah, that's going to wrap us up. I hope those resources are helpful to everybody. We'll list those in the description below so you can go and check out those resources, get that local practitioner to help get your diagnosis, help your referrals for treatment, and check out Dr. Clair's YouTube channel. She has a bunch of other videos there, more information, more resources.
Thanks so much.